Good morning. I call to order the August 11th, 2020 meeting of the Saline County Board of Commissioners. Will the clerk please call the roll?
Mr. Chadwick?
Here.
Mr. Sparks?
Here.
Mr. Richardson?
Here.
Here.
Mr. White?
Here.
I ask that you please stand and join me in a flag salute followed by a moment of silence. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. We now move to the citizens input portion of our meeting where citizens may speak on county government, usually limited to 3 minutes, and pertaining to items that are not on today's agenda. Is there anyone who wishes to speak with the commission?
Good morning, Commissioner.
Good morning.
You mind if I take this off?
Go ahead.
Okay. My name is Jeremiah Hayes. I am the treasurer for the FOP bargaining unit for the county, for the sheriff's office. And I wanted to come before you today. I know you guys are, the commissioners are looking at finalizing the budget. And we've been doing negotiations with the county administrator and with human resources. And we wanted to basically bring forth what our proposal was for this year. And through negotiations, it's been kind of with everything going on. We've been doing teleconferences and Zoom, and communication was not always, couldn't hear what was going on. So basically, we wanted to bring what our proposal was to you today, since you're looking at finalizing the budget. And basically, what we've been asking for and what we want to do is to change the bonus structure for the entire county employees system. And the current system is, as you know, is 25 years. You have to be here 25 years before you get a bonus, which I believe is $500. What we propose would be to change that structure because, granted, I will be here, when I get here, when I'm 25 years here, my kids will be gone and graduated, as will most employees, before we ever receive a bonus. So we basically want to propose something to the effect of where at year 8, where if you know on our schedule, everybody is frozen at year 8, you don't get a pay raise. And we want to implement something to the effect of where employees would get $2.50 for every month they've worked here, which if you do the calculations, at 8 years, each employee would get a $240 bonus at the end of the year. Around Christmas time is what Human Resources said would be the best time to implement that at one time. We gave that proposal to the Human Resources. They told us that that bonus, if we implemented that and did away with the current bonus structure, that it would only cost the county about $75,000 a year. And you know, in the budget that we have, we didn't think that that was not appropriate. We thought that that was actually pretty appropriate for what we're trying to do. Granted, this would include the entire county. It wouldn't just be the sheriff's office. I know I speak on behalf of the FOP for the sheriff's office employees, but I also have Jessica Hall, who's with SCAPE, and she's with the county, the civilian side of the bargaining unit. So basically, we just come before you today to tell that to you, tell you what we've proposed. I know this is a public part of the forum, so you're not going to respond, but we just wanted that for you something to think about. That's what we proposed. That's where we're at. And I know the county administrators talked about a 1% pay increase across the board, and I know the units have talked about accepting that if we could seriously look at changing the structure of the bonus program, which I think would benefit. It would help with retention. It would help keep employees. It would also be a great pat on the back in these hard times for employees that are considered essential, like myself and a lot of other people. It would be a huge, I think, morale booster to the county, if you would, to implement something like that. And that's all I had to say. Thank you for your time.
All right, thank you. And in slight response, we have discussed all of those things, Jeremiah, with our, I mean, those things did come back to us, and we have discussed them. So it's not off the table at this point yet. So Anyone else wish to speak with the commission? Seeing none, I'll bring it back to the commission. The consent agenda for today consists of approval of tax roll adjustments, approval of accounts payable, and approval of public forum agendas presented. Are there any commissioners who wish to withdraw any of those items or amend them? Hearing none, hearing no objection, the consent agenda will stand as approved. We'll move to public hearing items. Item number 1.
Public hearing for Saline County, KIP Sewer District, and Rural Fire Districts 1 through 7, fiscal year 2021 budgets, with Philip Smith Haynes, County Administrator.
Good morning, Philip.
Good morning, Mr. Chair, members of the commission. I will be very brief because the point of this is to hear from the public, not from me. The county budget that is before the public and the commission today would be a total expenditure of county funds in the amount of $52,517,823, which represents no increase in the mill levy for county funds and is under the tax lid. Additional $962,314 would be expenditure for the various special districts. The budget was published as required on July 29th. It has also been available on the county website and a public copy for viewing in our office. At this point, I would ask the commission to open the public hearing, take any public comments, close the hearing, and then move on to the action item.
All right, this time I will open it to any public comments regarding the 2021 budget.
Good morning. Good morning. Joan Ratzlaff, Salina. I'm in District 1. I just want to say on behalf of Salina Area Workers Coalition, I want to urge you to include in the budget increases for our county employees that they deserve. They should have, at least keep up with inflation. I don't hear them asking for very much. I want to remind you all that there are 5 of you because of public support for our county employees, and appreciate that you all agreed to reduce the annual pay that commissioners receive as 5 instead of 3. But it's time to do right by our county employees and include that in the budget. Thank you.
Thank you. Anyone else wish to speak to the commissioners regarding the budget? Seeing none, I'll bring it back to the commission for comments and questions and so forth. I will say that I'm very happy this year that our budget did increase slightly, but our mill levy did not. And we did that through frugal spending over the last few years. The county adopts a policy that just because the money's in the budget doesn't mean we have to spend it. And if we don't spend it from the prior year, it rolls over into the next year and goes into the general fund. And that helped us be able to increase our budget slightly this year and not increase the taxes. So that is the premise for which we try to operate and keep things in line as far as the county goes. I want to also say that it's been a tough year. We don't know what's ahead. You know, our budget is predicated on property tax. And what's going to happen to those property taxes in the year 2022 and so on is yet to be an unknown. So be prepared, I guess is what I would like to say. So at this point, I would call on my fellow commissioners for their comments.
I don't have a comment, Mr. Chair, but I will move that we adopt Resolution 20-2031 and approve the fiscal year 2021 budget as published.
Second the motion.
It has been moved and seconded that we approve RFA 196-20, Resolution 20-2301, adoption of the Saline County KIP Sewer District and Rural Fire Districts 1 through 7 for the fiscal year of 2021. Are there any further questions or comments from commissioners? If not, all of those in favor of the motion, please say aye.
Aye.
Aye. Opposed, same sign. Motion does carry, 5-0. We will move to item number 2.
RFA 195-20, Sunflower Adult Day Services 2020 contract with Rosie Walter, Department of Senior Services Director.
Good morning, Rosie.
Good morning, Commissioners. I am before you today asking to renew the Sunflower Adult Day Services contract for food services for 1 year starting August 1st to July 31st, 2021. We provide nutritious meals to all of their patrons that they have over there, and we would like to continue that. County Council has approved.
Questions or comments from the commissioners?
Couple questions. Did the fee structure change at all from
It did
last
not.
year's?
We have not raised our price since the last time.
And second, do you send bulk food over there, or are you sending individual meals?
No, they do eat family style. So we just put it in however many chicken breast in a big pot, mashed potatoes.
That sounds a little bit unusual from today's world of
It does, doesn't it? I'm sure their
COVID
staff.
situation, but that's, I guess that's up to them.
Well, I'm sure their staff follow all the protocols.
All right, and, other further comments from commissioners? Is there any public comment? If not, I'll bring it back to the commission for approval.
Mr. Chairman, I move we approve by signature the 2020 Sunflower Adult Day Services contract ending July 31st, 2021.
Second the motion.
It's been moved and seconded that we approve RFA 195-20 Sunflower Adult Daycare Services 2020 contract. Further comments? All of those in favor, please say aye.
Aye.
Opposed, same sign. Motion carries.
Thank you.
We'll move to item number 3.
RFA 197-20, Submission of Coronavirus Relief Fund Direct Aid Plan to the State with Philip Smith Haynes, County Administrator.
Good morning again, Phil.
Good morning again. So in the earlier action from our office, the commission approved a budget of about $52 million for the county that was based on many months of work and a long-standing tradition of state law and clear expectations of what our requirements are. In this item, we're asking the commission to approve $11,026,434 in expenditures and submit those to the state for the Coronavirus Relief Fund without the benefit of the many months of preparation and settled expectations that go into typical budgeting. In this case, the state of Kansas has passed through federal money with very limited guidance. And so to deal with that, your commission on July 7th appointed a 7-member advisory committee. That committee has met a number of times and has come up with some recommendations on how to expend those funds. The committee is before the commission today for your approval, and I will say we received more than 100 applications for this funding. We appreciate all of the preparation from all of the folks who submitted applications. Ultimately, the committee's recommendations were transmitted to commissioners last evening, and I'm pleased to note that although we didn't start out this way, the committee ultimately came to a pretty wide spread of the funds around the community and among the different applications. So it's going roughly a quarter to nonprofits, a quarter to for-profit businesses, a quarter to education, and a quarter-ish to governmental agencies. So what's on the screen behind me is the order of the different recommendations from the committee from largest to smallest, and I will just go through the first few here for the benefit of the commission, and then I'll be happy to answer questions from the commission, take public comment. I know there are several of the committee members who are here today. The largest recommendation from the committee is for a partnership between the county and the Salina Area Chamber of Commerce Foundation. The foundation requested $3 million in funding. The committee is ultimately recommending just over $2.7 million of that funding. And this would be for the purpose of creating a grant program for small businesses in the community that have been impacted by the COVID-19 pandemic. This is one of the clear directives in the federal guidance. There's, as I mentioned earlier, not a lot of clarity in the state and federal guidance, but benefits to small businesses is something that's clearly spelled out in the federal guidance. We did have over 37 businesses in the community that did submit applications. The committee ultimately decided, rather than trying to weigh each of those individual applications and weigh through them, it would be in our interest to create a program to get further information from each of those businesses and include businesses that did not submit in the very tight time frame. The second application is for USD 305, and education is another clear high priority. As you know, the school systems are facing reopening decisions at this point in time, and so getting funding to our schools to allow them to safely educate children in the face of the COVID-19 pandemic was a clear priority both for this committee and for the state guidance. The third highest, I believe, is the city of Salina. Yes, so as you know, the city of Salina has been impacted dramatically by the COVID-19 pandemic. Unfortunately, one of the stipulations in the federal funding is that it cannot be used to replace lost revenues from local governments. However, the city did identify a number of expenditures that they have had related to the pandemic, and we do believe that this will assist the city in their recovery efforts. Next is the county. This includes a number of programs, including our administration of the fund itself, our reimbursements for costs that we've already expended, and about $325,000 in new programs that are proposed by the county for things like telework. Then we have a number of other recommendations that are spread out around a number of nonprofits in the community. The couple of the big ones are the Salina Family Health Care Center. This would allow them to purchase a mobile medical and dental unit that they could deploy around the community so folks didn't have to travel to doctors' offices during the pandemic. Child Care Aware would create a grant program for child care centers. Child care is a clear priority of the committee as well as the business community in allowing parents to return to work. And then finally, I'll mention the YMCA. This funding request funds about 5 or 6 different programs within the YMCA, several of which are partnerships with other entities within the community. So I'll stop there. Again, be happy to answer questions about anything on the list, any of the committee recommendations. Finally, I will say, in a normal situation, we would have had an opportunity for the commission to have had a lot more time to go through all of this and give some feedback to the committee and so forth, but that's just simply not the case in this situation. The state is requiring us to submit a plan by this Saturday, and so that's where we are, and I thank the committee members for all of their hard work.
Well, first, let me echo that comment, and I want to thank the committee for their hard work, their due diligence, their willingness to get in here and roll up their sleeves right away. Philip Smith-Haynes, our administrator, was the chairman. Our emergency preparedness director, Michelle Barkley, also served. I see members out there, Kristen Gunn and Charles Roth and Pam Smith, along with Dr. Dirk Hutchinson and Tom Bell were on that committee. And from what I've heard, they really worked hard. The governor and the Spark committee gave us, literally, and the committee, not much time to get this done. And as Phil said, the commissioners got this last night a little after 5 o'clock. People my age go to bed right after sundown anyway, so I haven't had a lot of time to and sometimes before sundown. But at any rate, we appreciate your hard work, and this is pretty impressive to me. I do have a question regarding the very first one, the Saline Area Chamber of Commerce. That money, they will, and you explained what they were going to do with it. Does that ultimately come back to us for approval?
Yeah, the committee had a number of recommendations around how they would like to see such a program structured. And so if your commission approves this, and Chamber Executive Director Eric Brown and I plan to meet later this week and start hashing out some of those things. I believe all of these individual programs, except for the ones that are going to the cities and schools, will require an agreement be executed between the recipient of the funds and the county. And County Councilor Mike Montoya is working on language for such an agreement right now. The chamber one, because it is such a big, well, I will say the chamber one and actually the child care aware one as well, because of the magnitude and also because they plan to turn around and ship that money out to other entities, those will probably require a little extra layer in that agreement.
And they will have to follow the same guidelines that every other the criteria that to be rewarded the funds.
Absolutely.
And
yes,
that sounds like a very good plan. Happy to see the chamber get involved and be able to get that out there. So at this time, other commissioners have comments or questions?
On the chamber foundation aspect of it, will those 37 businesses have to reapply, or I assume it just rolls over on?
So that's one of the things, Eric and I will talk about, but the committee certainly said that we would prefer that we just give those 37 to the chamber and let them deal with it. Now, whether the chamber requires some additional information or how that works, I will note in the chamber's proposal, they had proposed a maximum dollar amount for each business based on number of employees and so forth. And some of these businesses requested very small amounts, some requested very large amounts. Right. So I think there would need to be some tweaking to those applications to fit the chamber's program, but certainly better than not funding any of them.
Will they be under a certain time frame? I know it's kind of an end-of-the-year thing.
Thank you, Commissioner Shadwick. Yes, I should have mentioned that in addition to the rushed process on the front end of all of this, there is a tight time frame for expending all of the funds. All of these funds The entire $11,026,434 must be expended by December 30th of this year. So the chamber will absolutely be under a tight time frame for getting those monies out into the community, as will all of the other recipients.
One more question, Mr. Chairman. Remind me the accountability aspect of this. How are they showing that the money was properly spent? Whom do they show that to?
So they'll be required to submit invoices to the county. The county's required to retain those invoices for a period of 5 years, and then we turn around and submit those to the state. It's our understanding that the state is going to review everything that is submitted. I don't know the level of detail of that review. They are still staffing up their Spark office in Topeka. They have a new person on board as of yesterday to manage the county program.
Thank you, Mr. Chair.
That having been said, I assume, and want everyone to know that if someone applies for the money through us and the state runs an audit and they say that, $100,000 of this is not approved, the business does have to give that money back to the state. Is that correct?
Yeah, so technically the county has signed an agreement saying that we will have to give it back to the state, and then the agreements that we will seek with each of these businesses will say exactly what you said, Mr. Chairman, that we want to get that money back from them.
So do we take that money out of your pay or the committees or who? We're counting on you here. Okay, other commissioners' comments, questions? I think normally I only take public comment on RFAs and action items, but I guess this is an RFA, so I will open it up for anyone from the public who wishes to speak or make a comment regarding this. Please give us your name and address, please.
Good morning, Commissioners. My name is Lori Barnett, and my address is 2196 Wesley here in Salina. I was one of the 37 that applied for the grant. I would like to say I appreciate all the work that the committee has done on this. I understand the slight timeline that they had in getting this processed, but I will say that it's a little frustrating. Given what we were asked to do and turn in our applications, the 37 of us that did, we met the guidelines and we turned it in like we were asked to. It was a little disappointing to not feel like, I guess that our applications were really looked over very well. I was assured that we were. I watched all the meetings and listened to all the comments. I guess what I really want to say is I'm hoping that the chamber, when I understood that we were going to have to reapply, it was a little frustrating to know that we were going to be lumped back in and that other people were going to be applying for this same money, because there was a deadline for it. So now, if everyone else is allowed to apply for this money, then that kind of defeated the purpose for us to apply in the first place, I guess is what I'm saying. I applied on behalf of my in-home childcare, and I do feel like in-home childcares are being really kind of left out of understanding what's happening with the coronavirus. I serve children ages 2 through 12. Half of my children are preschool age and younger. The other half are grade school age and older. And this year is going to be a very trying time for the 120 daycare providers in this town that are going to be trying to care for children ages 2 through 5 while also teaching children those 3 days a week when they're out of school. And I really feel like as a community, we are missing that group of children. We are forgetting about them. Daycare centers are going to be caring for the littles. The middle school, I understand KDEB has a great program that they're going to offer for our middle school students. Middle school students are they can take care of their own homework. They've learned that by now. But boy, we sure do have a whole group of kids that are going to be left behind. And those K through 5 students, they do not know how to do their homework on their own. So that really is falling back on daycare providers. And we could really use some help. We really could. And that was my whole purpose for applying for this, was to bring awareness for those children. And I think as a community, we've really failed on remembering how it's going to be for them. They're going to be in school 2 days a week. The other 3 days a week, they're going to be home with us. And that is a job that we didn't ask for, but we're willing to take on. And I feel very passionate about it. And I'm very, very worried for these children. I'm going to have 6 students in my home that I'm going to be trying to teach at the same time I'm watching 6 other children, plus taking them all to school and picking them up. And it's a lot. It's really a lot. And this money that we'll be receiving from the, trying to think, it'd be the Child Care Aware. I believe that they ask for a grant. That money is not going to help us teach these kids. And the money that I applied for was so that I could hire a second person to come in and help me teach. Because I'm at a loss. 12 kids all day, plus taking them back and forth to school, I'm only going to be spread so thin. And I'm going to do my very best because I love each and every one of them. But daycare providers need some help. And I sure hope that you all recognize that. I'm very passionate about it. I apologize. I'm very emotional about it. Anyway, thank you for your time.
Well, I feel compelled to speak back just a little bit. And you said that you were really up against it in the time frame. I think what we were up against was dealing with all of these and such an enormous amount of money. And if you feel like you've had a proposal that is merit, I'm certain that the Chamber of Commerce is going to look at just that. I mean, I've seen emails lately. That is priority number 1 with the Chamber and the school board is child care, and getting people back to work. That is their top priority. And I'm certainly not capable of making that decision in the right way. I'm not an educator and I'm not a child care provider, but I know that they are, and they've got people that are on it right now. So I can't imagine that your proposal that you submitted to the county wouldn't be sufficient to submit to the Chamber of Commerce. So I wish you well in that, and everyone is aware of the child care provider situation right now. So don't feel like I can understand that you feel left out, but you're not. It's on everyone's radar.
I appreciate that.
So,
thank you.
Thank you. Does anyone else wish to address the commission regarding? If not, I'll bring it back to the commission for approval or a motion.
Mr. Chairman, I move we approve the recommendations of the committee as presented and uphold the required submittals to the state.
Second motion.
It's been moved and seconded that we approve RFA 197-20, submission of Coronavirus Relief Fund Direct Aid Plan to the state. Is there any further discussion? All of those in favor of the motion, please say aye.
Aye.
Aye. Opposed, same sign. The motion does carry. Again, I want to thank the committee so much for their hard work and due diligence in this emergency situation. So thanks to each of you. We'll move on to item number 4.
Resolution 20-2297, review of Section 6 mask mandate with Jason Tiller, Health Department Director.
Good morning, Jason.
Good morning, gentlemen, everybody.
Good.
So it's been 2 weeks. There we go. So again, like the last time, just kind of starting at the national level, we've reached over 5 million cases in the U.S. and over 163,000 deaths, and this is as of noon yesterday. Since we're kind of doing this every 2 weeks now in this similar format, I'm going to start adding, like I did today, what those changes are so you can have just an idea of what that is. So that's about almost 800,000 new cases and 16,000 new deaths in the last 2 weeks. And that's nationally. In the state of Kansas is now up over to 31,000 cases since the beginning, and that's 6,000 more in the last 2 weeks. And I think probably the biggest jump in the last 2 weeks of deaths, where there's been 52 additional deaths in the state in the last 2 weeks. At the county level, so we've got some red and some green. So we've got some good news and we've got some, well, just continuing trends, I guess. So 389 cases total in the county. That's 62 more since the last update. However, we have had, we're up to 285 recovered. So that's why you see the green there. Although it is a plus in the number of recovered cases, but that is a good metric. We want to continue to see that number increase. The active number, of course, is down, but that number fluctuates. So right now we're at 99. And then we had one additional death from the last update. Hospital still averaging about the same. Counties, I'm sorry, the state's positive rate is at, I should have brought my glasses this morning, 9.8%, which is up 0.5% since the last time. And our case rate right now for the county is 6.8 per 1,000 residents, whereas the state of Kansas is now at 10.89. So we're still doing better than the state overall. Just looking at the trend, since from our last one, we did kind of hit the end of July and then going into August. So this is July, and you can kind of see starting at about July 20th, the weekend before that, I think it was, we had like 14 and then 16 cases, you know, in those days. And then we kind of have taken now this, what I kind of call a smoldering level of cases, because they're just a handful each day, but it's continuing each day, except for the one blip that we had there on August 4th, which was a Tuesday, and I think that one was just related to delayed reporting from the lab from the weekend, because those cases weren't related to a cluster or to anything, they were just from various circumstances. A couple of other things I wanted to mention. So since May, we've been having bi-weekly meetings with all the colleges and universities, the K through 12 schools, and public health. We have been sharing information with each other, resources, planning for reopening, looking at the situation. As one organization might be trying to figure out how to address or find a solution to a problem around reopening, and maybe one of the other organizations has something that they've tried, so it's been a great coordination and sharing of information. And from this too, we have been working on a decision matrix, and it's been a challenge because there are no good models out there, because by the time the pandemic got into full swing, all of the schools were closed in the spring. So there's not any real good modeling data that says, okay, this is what's going to happen. There's not any good set of numbers at this point anywhere. And this is even after consulting with some staff at Wichita State and K-State, that we can say that at this percentage or at this number, X needs to happen. So as far as this matrix goes, most communities are working on something similar, I think. And we're all, it's going to be a living document that we continuously work on, but it'll be available to the public so that the public can see how decisions, when the community conditions change, what the assessment looks like and how those decisions are driven when schools decide to either, when one school district decides to stay in the mode where everybody's in class and another one decides to move to hybrid versus remote, so that there will be some transparency to that decision-making process. And then a couple things I wanted to say on data. I know that there are lots of rumors that fly around about data and numbers and who's counted and who's not counted and all that kind of stuff. But I can only speak to our data here in this county. And I know that for every number that's on those charts about the number of cases, that represents one person. It doesn't matter how many times they've been tested. Sometimes we've had where people have been tested 2 or 3 times, they come up positive 2 or 3 times because the virus particles can hang out for a little while, even after you're technically recovered. But they're still only counted once. It doesn't matter how many times they're tested. And then the other thing is that Everybody, for every positive test result we have, every single person that we have contacted and interviewed for those results has actually been tested. There was a rumor floating around out there about people waiting for hours. I think if you look at Facebook, you'll find it in this state, that state, and that they left, they never got tested, they got positive results. I can say 100% accuracy and assurance that that has never happened here. We have never had a single person say, well, that's odd, I never got tested, so I don't know how I got positive test results. We work very hard to ensure the validity of our data, that the numbers are correct. We still continuously have a little bit of an issue with KDHE's website underreporting our numbers, and we've been trying to get them to fix that, and that still is, but that's on their end. We send them our data and try to get them to fix it. And then I wanted to talk a quick minute about isolation and quarantine, just because sometimes it can get a little confusing. So isolation is for those that have tested positive or are ill with symptoms. We isolate the ill. Quarantine is for those who have been exposed to those who have tested positive. So isolation is generally for 10 days and 72 hours fever-free, whichever one is longer. So at a minimum, they're going to be in isolation for 10 days from the start of their symptoms. Quarantine is for 14 days from the date of the last exposure. So it is possible, as you can see on the screen here, that if someone is a household contact, meaning they live in your house, so say I test positive today, and my family members that are in my house, because we have exposure, have to be quarantined, but my isolation period doesn't end because, say, my symptoms started on Friday and I have 8 more days of my isolation period. Their quarantine will not start, that 14-day clock does not start until the end of that isolation period, because they are continuously being exposed during that isolation period. So that's one of those things that is constantly being explained over and over again. There are some examples on this chart about that. Non-household contacts are easier because generally their last exposure might have been 4 or 5 days ago by the time that the person who tested positive received their results. That's pretty easy to set a definitive start and end date. But it's the household contacts that are sometimes harder to set those dates for, because it just depends on when that exposure ends. On the other side, if somebody is in their 14-day quarantine and then on day 14 develops symptoms and gets tested and is positive, then that would start the 10-day isolation period. So there is possibilities, the way these scenarios work out, that somebody could be in isolation and or quarantine, and that lasts up to over 3 weeks. So I know we've had that out there on Facebook a few times, but during this forum, I just wanted to kind of bring that up and talk a little bit about that. Yes, sir.
Yes, Jason. Is it a person at that time would not be considered as recovered until after that 30 days or 28 days?
So the person that is positive, in order to be considered recovered, they have to have a significant reduction in symptoms, have finished their isolation, that 10 days isolation, and be fever-free for 72 hours without using medications. Originally, back in the beginning, you had to have 2 tests 24 hours apart, but that wasn't feasible when there wasn't enough testing. And then sometimes tests can take 4 or 5 days to get back. So somebody would end up having to sit another 10 days just waiting on tests. So the criteria is symptoms are significantly better, no fever for 72 hours without using medication, have finished that 10-day isolation, and then they're considered recovered. Now, being considered recovered does not mean, though, that they still don't have ongoing issues related to COVID. We have seen, and it's in the literature, and we have in many of the ones that we have seen, that still have ongoing health problems related to their COVID infection. So they're not considered active anymore. They have recovered in the sense that infectious period is over. However, their battle, I guess you could say, with COVID is not over yet.
Thank you.
Just before you leave that,
Yes.
so a person who is infected goes into isolation, does their 10 days, and the rest of the family will start their quarantine. Does that original person, are they free to leave that quarantine and be back out in the general public?
So the original person that was infected, once they finish their isolation period, yes. The rest of the family members are in their quarantine, but the original person who was the index case for the household, once they finish their isolation period and have been released from isolation, yes, they can leave the home. At that point, they're not shown to transmit it anymore.
Well, Mr. Chair, as I said 2 weeks ago, I appreciate my fellow commissioners putting up with this part of my motion that we do this every 2 weeks. And so it is not my intentions, obviously, to make a motion that we get rid of it right now. But I do think I learned something, and I think the public learns something every time that Jason presents like this, and I still think it's helpful for us to do that, especially the myths that are out there.
Yes, sir.
You're coming up with some very valuable information for us to make the decisions, and helps the public also in their understanding of what's going on, because I too have heard some of the things that you've absolutely said, and get into some pretty good discussions with a couple of my friends over it, and so it's valuable information. I'll win the next argument with those guys, I can tell you that. I might have won anyway.
The one that I can at least speak to is, the rumor that when people turn around in the long lines, that they get, tested and it says positive. And I can only speak to my experience. And yes, I did have to wait an hour in line. And I did see people turn around. But you don't register your name until you're the car right in front of the testing thing.
Right.
So they never knew Monty Shadwick was in line until after an hour when I got to the first tent, and then you registered, and then you went and you got tested. So anybody that turned around, now again, that's only my experience, but I can't imagine it being different in any other situation.
So like when Walmart was doing the drive-through testing, there was an appointment list, like it is when you go to the doctor and they have your appointment list of who's scheduled to show up that day. But that doesn't really count until the end of the day when whoever actually showed up, that's the names that get counted that day for who actually, and it was the same way. Their appointment list wasn't useful for us in a sense of who actually got tested for trying to make sure that we were reconciling to have results. We had to know at the end of the day who actually got tested.
Right.
And so, yeah.
Do you believe that we are getting the right people tested? Do you think people are not getting tested because they're worried about the delays and it just doesn't matter? I mean, that's one of the things you hear about, and I'd like to know your thoughts on that.
I think sometimes some of the reason that people don't get tested is that because they know by getting tested that they're going to have to miss work.
Wow.
And so I think that's one aspect of it. One of the things that we're kind of running into lately, and we're trying to educate people, is the stipulations under the Family First Coronavirus Relief Act, and how that 80 hours works, and I think Maryland's already left, but and then how businesses are supposed to, work with that act in relation to like family medical leave, what businesses actually qualify, because we've had, at times a couple of people call and say, well, if I'm on isolation, they're going to fire me. Well, technically, I'm not an HR person, but our understanding is that they are not supposed to be able to do that under that Family First. But again, we have kind of started steering them toward Kansas Legal Services. Definitely tell them to talk to their HR to make sure of what their options are under that act. And then, but I think that's one of the bigger issues.
Jason, let me ask a hopefully it has a short answer to it. But if someone is feeling, like they need to be tested, what's the process?
Contact their primary care
Contact their
provider.
primary physician, and they will then guide them in the direction that they need to go, where to get tested, so on.
Right. So what a lot of them are doing is just kind of a primary screening over the phone. If they determine that, yes, this sounds like COVID, or you've had exposure to COVID, then they'll direct you to one place to drive through, like Stat Care or someplace like that, and get tested. Or if you're going to come to, like, say, Saline Family, come to this specific door. This is where testing's happening. If it's something else or it's unsure, then they'll do additional screening, have them come in, make an appointment, that kind of stuff, because every illness is not COVID. Every accident is not COVID. No matter what they see, not everything is counted as COVID. So they want to make sure that they are doing the right screening to get them the right treatment, so.
Okay, that makes a lot of sense, and encourage people to contact their primary physician. And, your sinus headache does not mean you have COVID necessarily.
Not necessarily, no.
Yeah. Okay, any other questions from commissioners?
Yeah, a couple. When you're speaking about testing, some of the problems have been as the length of time to get the results. And are the quick turnaround tests now available in Saline County? Are you seeing those available? And to follow up, what is the validity of the test itself? You hear about a lot of false tests.
Right. So the gold standard of testing is the PCR, and that's the one going up the nose. Whether it is the very all the way back, feel like it's tickling your brain swab, or they do have another one that kind of what they call anterior nares that kind of goes not quite as far back, but those are still PCR, and those are the gold standard. The point of care, like quick tests that you're referring to, they are from my understanding, a rapid PCR. I believe the hospital has a small handful that they basically reserve for like really sick and they need to know now kind of thing. The issue with trying to get those is a supply chain issue. They're just not being produced fast enough to be able to get into the hands of all the hospitals and everywhere else that need them. I know that some health departments have talked about trying to use some different funding to get those machines, and quite frankly, they're not going to get it for 6 months if they ever do get it. So that's where the drawback to that is. As far as the validity, if it's PCR, whether it's the point of care or if it's the up the nose and still takes, has to go to a private lab or to a complex lab, I should say, and be processed, I think the validity is about the same, which I don't know the percentage, but it's upwards of 90% or greater. If it's positive, it's positive.
Thank you.
All right. That's all I've got, so.
All I've got.
I'm going to bring it back to the commission for, and I assume that your suggestion is that we continue to wear face masks.
Right. I will tell you, with colleges and school getting ready to start, this is my most probably nervous point right now. Because there is no real data. We can look at some other countries. We're watching now what's happening in other states, but we really don't know, and I still can't find anybody to fix my crystal ball, so if you know of anybody that can help with that. But we just really don't know, so we're going to be watching that closely. Consistent communication with everybody as far as the colleges and schools as we move into this time period.
I don't think we need a motion then. We're just going to continue to look at it again in a couple of weeks, and hopefully we can continue those really low numbers that I think it has made a difference.
I hope so.
That's my opinion. So, all right, thank you for your update.
Jason.
Thank you for all the information. We'll now move to informational items. Item number 1.
County Administrator's update. Excuse me. Phillips and Thames County Administrator.
Greetings again. Just one thing that I wanted to brief the commission on this morning, an update on our radio project. As the old saying goes, there's no rest for the weary. So we are rolling right into our next project here. And next week, Deputy County Administrator Stambaugh will not be able to join us at our special meeting out at Road and Bridge because she will be in day-long interviews with, or negotiation sessions, I should say more accurately, with our vendors that submitted responses to the RFP on the radio system. Our schedule for next week is to have a 911 committee meeting on Monday afternoon and then to have negotiations with one vendor on Tuesday and Thursday and with the other vendor on Wednesday and Friday, and hopefully by the end of the week be in a position to bring a recommendation back to your commission as well as the Salina City Commission, and Hannah will be briefing me and the city manager each evening on progress of those negotiations. So that is rolling along, and that was all I had to share today, but I'd be happy to answer any questions.
Remind me again the date for the Road and Bridge meeting.
That will be next Tuesday, the 18th,
Tuesday.
and we'll have our regular meeting here and at 9 o'clock, and then we will be out at Road and Bridge a little later in the morning, probably 10:30, 11, somewhere in that range.
All right. Any commissioners have any questions for Phil? All right, we'll move to item number 2. None. Item number 3. I will say that we will adjourn this meeting directly and immediately reconvene to finalize the vote canvass, and that will be immediately following this meeting. I assume that they've brought that to you, Jamie?
Not yet, they're almost done. So they're finishing it up right now.
Okay. I would take a motion for adjournment.
So moved.
Second.
It's been moved and seconded that we adjourn today's meeting. All those in favor say aye.
Aye.
Aye. Opposed, same sign. We're adjourned.